इस टाइम पे it is not the only hard work that you have put in right from the past 1 year that will help you out in cracking this exam. Think about how you can utilize this time which is running away very smartly and you can get all your questions right. They are the rank deciders because everybody is going to read the major subjects. This is going to be my cheat sheet for your ENT in NEET PG exams. Hello dear medical students. Now past is history. Future is a mystery. But present is a gift. This is a very famous line from one of my favorite movies, Kung Fu Panda. And what does it tell you? कि जो हो गया उसे हम बदल नहीं सकते, जो आने वाला है वो हमने देखा नहीं. But अभी का जो time है, that is the most important in order to capture and conquer NEET PG exams. Now we are a week away from NEET PG. और इस टाइम पे बहुत सारी anxiousness build-up होती है. It's a very overwhelming feeling inside every one of you. And I can understand as a student because सबके अंदर ये feeling होती है, it's very normal. But what if I tell you that इस time पे it is not the only hard work that you have put in right from the past 1 year that will help you out in cracking this exam, but it is actually more than hard work, the smart work which you push in the last 7 days which will help you crack this exam very easily. Because NEET PG is not a game of hard work, it is a game of smart work. Now, one of the very commonly asked questions about my subject, that is ENT, is that ENT is a very vast subject. And sir, tell us ways in which अगर हम कुछ चीजें important पढ़ लें, we will be able to at least understand या crack the questions that come in NEET PG paper. Now understand, ENT is a very predictable subject as far as NEET PG exams are concerned. And why am I saying that? Because there is a trend that they have been following. There are a set questions they have been following, set chapters they have been following, which every year they keep asking. So ENT specifically is not something which you should read everything around because वो याद नहीं होगा. I am concentrating about the 8 to 10 questions every year that they ask. And if they are asking 8 to 10 questions, it's very easy to crack them. So don't watch the clock क्योंकि वो time निकलता जा रहा है and you will be becoming overwhelmed. Think about how you can utilize this time which is running away very smartly and you can get all your questions right. So in this particular segment, I am going to concentrate upon the must know important chapters of ENT and I'm going to give you a list of those topics. बहुत ज़्यादा topics नहीं है, it's easily manageable and that is my strategy of cracking ENT easily in 2 days. Now I'm not even asking your whole 2 days. I am just asking a part of your 2 days. That means even if you devote 4 to 5 hours per day, if you have not done anything, just recap these important topics so that you can get all the questions of ENT right on spot correct in your NEET PG exams. And this is going to be my cheat sheet for your ENT in NEET PG exams. Now I have given this in the form of 4 segments. That is ear, nose, pharynx and larynx. Okay, there are these 4 segments. अब बहुत ज़्यादा vast है. If you see each and every segment, there's a lot of things inside each and every segment, but हमें सब नहीं पढ़ना है. This is what I'm trying to tell you, right? So even if you have not touched many of the topics here and there, this sheet will help you to capture major topics of ENT and where the questions have been coming again and again every year. And trust me, 80 to 90% of the questions will be from this sheet. Okay? So let us see what exactly you need to do. Break your days into 2. That means on one day, we will read ear and nose. On one day, we will finish pharynx and larynx. These are the 2 days. और ये पूरा दिन भी नहीं पढ़ना है. You have got plenty amount of time. You have got 24 hours in a day. And in that, I'm just asking you to devote 3 to 4 hours so that you can easily recap quickly the important things which have been asked in these chapters. Okay? So what do you need to understand in the ear? In the ear, very commonly asked question is from embryology and anatomy. Embryology and anatomy is very, very important. Now, what we have been saying, embryology of external ear, middle ear and inner ear, all 3 are important. So, at least see where the derivatives are coming from. From the anatomy, the middle ear is the most important where they have constantly been asking about the posterior wall. So, don't miss out on the posterior wall of middle ear as far as questions are concerned. Now comes the most important part. These people love to give you audiometry related questions. So, the important pure tone audiograms, important pure tone audiograms जैसे कि otosclerosis में Carhart's notch दिखता है, Boilermaker's notch is seen in noise-induced hearing loss, right? So these are like set questions. So you should know exactly ये pure tone audiogram किसका है and what exactly is the interpretation of it. and this is very commonly asked in your papers also, right? So pure tone audiometry interpretation is also very, very important. Now coming to the next important point. Now they have been constantly asking about what are the waves of Vera, that is what are the 7 waves of Vera and how do they correspond, and the question on autoacoustic emission. So इनके at least waves of Vera देखनी है, and you need to know something about what is autoacoustic emission and how it is produced. That is also they have been asking quite a lot. Okay. तो ये खत्म हो जाता है अबाउट फ्रॉम द बेसिक्स ऑफ ओटोलॉजी, दैट इज अबाउट व्हाट इज एनाटॉमी एंड व्हाट इज द ऑडियोमेट्री रिलेटेड क्वेश्चंस. अब आते हैं डिजीजेस ऑफ ईयर. डिजीजेस ऑफ ईयर में वन डिजीज विच यू शुड नो फ्रॉम द एक्सटर्नल ईयर, अगर कुछ नहीं करना है तो एक डिजीज एक्सटर्नल ईयर की आनी चाहिए, दैट इज मैलिग्नेंट ओटाइटिस एक्सटर्ना. एंड मैलिग्नेंट ओटाइटिस एक्सटर्ना से रिलेटेड बहुत सारे एमसीक्यूज रिलेटेड टू इन्वेस्टिगेशन एंड ट्रीटमेंट आते हैं. तो इन्वेस्टिगेशन एंड ट्रीटमेंट ऑफ मैलिग्नेंट ओटाइटिस एक्सटर्ना हैज टू बी वन ऑफ द मोस्ट common things that you will encounter in your NEET PG papers. Please don't forget this chapter. अब आ जाते हैं सीधे मिडिल ईयर कंपार्टमेंट में. मिडिल ईयर में दो डिजीजेस सबसे इंपॉर्टेंट है. वन इज क्रॉनिक ओटाइटिस मीडिया, वन इज ओटोस्क्लेरोसिस. Chronic otitis media may be the trend of asking questions is most commonly from complications of chronic otitis media. Please don't miss. And also the most common among those complications are mastoiditis, petrositis. So don't miss out these two complications, right? And in the extracranial complications, the abscess of the neck. Right, like Bizold abscess, City's abscess, Lux abscess, these are the ones which are asked in extracranial complications. तो इनसे बहुत questions आते हैं. Now we come to the inner ear compartment. Inner ear में अगर आपने कुछ भी नहीं देखा है, at least see and go the important questions of Meniere's disease. Very important. Even the variants of Meniere's disease is very important, right? Many questions come from Meniere's disease and vestibular schwannoma, which is the most common question to be asked from the 8th cranial nerve point of view. So vestibular schwannoma associated questions also are a lot. Okay. Now you have to also understand about two important diseases where they will ask you one classification of ototoxic drugs, जिसमें बहुत सारे mnemonics भी हैं, that is ototoxicity, and one is noise induced hearing loss, जिसमें सबसे important चीज is the audiogram of noise induced hearing loss. Okay. Finally, very important point जिसको आप हटा नहीं सकते is every year or every alternate year they will give you some question related to a rehabilitation of hearing. And that will be focused on either a hearing aid or a bone anchored hearing aid or an auditory brainstem implant or a cochlear implant. So you cannot miss inside the year the rehabilitation devices because they form one of the most favorite questions of NEET PG as far as otology is concerned. This is all what you need to know as far as ear is concerned. So अगर हमने कुछ भी नहीं किया है, you will at least get 70 to 80% of otology questions only in these high yield topics of ear. Okay. Now let me come to nose. Nose is very straight and simple. यही चीजें बार बार आती हैं. They will ask you about the blood supply of nasal septum and Kiesel Black's plexus and Little's area. They will ask you about allergic fungal sinusitis and some kind of a criteria which is associated to allergic fungal sinusitis. Carcinoma of maxilla is somewhat which has been recently introduced as a question. So they have given questions regarding treatment, regarding Ongren's line. They have given question regarding the signs of CSF rhinorrhea, and this is something where they will ask you laboratory investigations, investigation of choice, treatment strategies. Then they will ask you nasal polyps. Both antroconal and ethmoidal polyps are very important. The syndromes associated to ethmoidal polyps are also very important, such as Cartigenous syndrome, Church-Frost syndrome, Samter's triad. All of these things are important in here. Next question they commonly focus upon is they will point a structure in the CT nose and PNS. तो एक इमेज देखकर जाना, and which image you will see the coronal image because coronal section is the one which they will ask you as a question. So coronal image में see how a Haller cell looks like, an Onodi cell looks like, how the sphenoid sinus looks like, how does the bulla ethmoidalis look like, middle turbinate, inferior turbinate, how these important structures look like, right? So this is something that is very important for CT scan of nose and PNS. Now coming to the second day. So this finishes my first day. This is my first day of ENT. इससे मेरा first day finish हो जाता है. यानी ear and nose में अगर मैंने सिर्फ इतने topic करे, right? This will take hardly 4 to 5 hours to recap. Because मैंने सब पढ़ने को नहीं बोला. I just told you to flip off these important chapters before going for your exams, right? So this is also for your revision. No need to go for the whole textbook and start revising because that will never complete, right? Now we come to the second day strategy, that is about the pharynx and larynx. Pharynx also has got set amount of questions, but they majorly focus on the nasopharynx. So nasopharynx में we cannot miss juvenile angiofibroma and nasopharyngeal carcinoma. This is a do not miss strategy for nasopharynx. इन दोनों को छोड़ ही नहीं सकते. Juvenile angiofibroma has got many questions. Most favorite question is from the investigations and the scans. Nasopharyngeal carcinoma, they will ask you a lot of questions from clinical features. Okay, so these are the two things which are a must know as far as pharynx is concerned. Okay, you will get one of the questions from there. Finally, from your oropharynx, you just need to know two things. One is tonsillitis and one is tonsillectomy. So tonsillitis, mein usually what they ask is membranous tonsillitis, and the differential diagnosis of membranous tonsillitis se question aayega. And from tonsillectomy, they will ask you very commonly about complications of tonsillectomy, right? About the management of those complications of tonsillectomy, position of tonsillectomy. So these are the common questions that are must know as far as pharynx is concerned before you go for your NEET PG exam. Okay. Now coming to the final segment, the larynx, which is again a very, very important segment for your exams. Now, larynx has got a lot of images inside it. They will give you laryngoscopy images and they will ask you what is the management strategy, what is the diagnosis in this patient. So in the beginning, in your anatomy of larynx, never forget to read two things. One is the spaces of larynx and one is the muscles of larynx. So muscles and spaces of larynx is something you cannot miss out in larynx as far as anatomy is concerned. Coming to the next question that is very, very important as far as larynx is concerned. Both questions aate hain, which is vocal palsy. Vocal palsy mein we need to understand nerve supply of larynx is their favorite question. Then they will ask you about what is the management of four important things. And this you need to understand. Unilateral and bilateral recurrent laryngeal nerve palsy ka kya management strategies hain? And they will ask you about unilateral and bilateral recurrent plus superior laryngeal nerve palsy or a combined palsy. Isme kya management strategies hain? So they will create a question on that and they will ask you ki what will be your further approach, right? So always remember vocal cord palsy you cannot leave in larynx. This is something. Create a concept about all four and then try to answer these questions. Finally, coming to a recent question which has been added is from JORP, that is juvenile onset recurrent respiratory papillomatosis. So this is something they will ask you recent management trends of JORP. They might ask you a question on lasers. They might put up some kind of an antiviral drug which has been recently introduced in JORP and they will frame a question on that. Then coming to carcinoma larynx, also a very, very high yield topic of larynx, where they will give you staging of carcinoma larynx. They will give you a scan of carcinoma larynx. They can ask you from T1 to T4 staging of tumors, okay? And according to the stages, the management protocol of these patients. Now, not only here, a lot of questions are common from vocal rehabilitation post-laryngectomy. So here they will ask you questions on tracheoesophageal processes, they will ask you electrolarynx, they will ask you esophageal speech. So this is something which is also very important. So all in all, malignancy of larynx, concentrate on the staging and management and post-operative rehabilitation in laryngectomy. And finally, questions from tracheostomy and cricothyrotomy. So tracheostomy mein they will ask you usual questions from what are the indications of tracheostomy. They will ask you questions from levels of tracheostomy, high, mid and low. They will ask you questions from complications of tracheostomy. And they will ask you something about what is mini trach or cricothyrotomy. So this is my strategy of finishing ENT in just 2 days. I'm not saying give the whole day. Give at least 4 to 5 hours to at least recap these high yield points from each and every segment before you go for your exams. And trust me, 70 to 80% of your paper will drop in from these because they have been constant trends which they have been following since the past 10 years in asking these questions. Now, I always say that the subjects which carry 8 to 10 marks, they are the ones which are not as major, but these are the rank deciding subjects. So if you do well in these subjects, which are short subjects, which can fetch you 8 to 10 marks and they are easy to get 8 to 10 marks. In each of these short subjects, it's quite easy to grab. Then your rank suddenly gets pushed up considerably in comparison to the population. So my takeaway for you would be that don't neglect out the short subjects. They are not as major that they will take a lot of time from you, but they are the rank deciding subjects. These are the subjects, if you read well and if you get 80 to 90% of your questions right, then your rank suddenly will get pushed very high compared to the general population. So this is my take. Please read up the final topics which I have given you as a list. These are the trending topics since the past 10 years of time and there are very high chances they will ask you again. So before you guys head for your exams, I want all of you to recognize and believe in yourself and all that you are and all that you have done in the past 1 year. Because I know that all of you have put in a lot of hard efforts and you all are greater than any obstacle, be it NEET PG. So you can do it, you will do it. Go to the exam, crack the exam well, come out, have a smile on your face and forget what has happened. Don't worry about the result. Just give your best into it. So this is my strategy for cracking ENT in your NEET PG exams. Do well, keep reading and keep shining.